I'm Deborah Leaver. I'm a counsellor and I'm a member of Counselling Directory and a founder of Deborah Leaver Psychotherapists. I work from two venues, one in Walton-on-Thames in Surrey and the other in central London. I'm going to talk about drug addiction, how it can affect mental health and how a therapist can particularly help. If you're ready to connect with a counsellor, you can find me and other qualified professionals on Counselling Directory, or you can find me at www.deborahleaverpsychotherapy.com. Now, with drugs, the most commonly used and mood-altering drugs is actually caffeine, which is really interesting because you wouldn't think about caffeine as being a mood-altering drug. And apart from medicines, which of course we all need, the next most commonly used drug is alcohol. And then that's closely followed by nicotine and cigarettes. Now, what we talk about as drugs is they fall into different categories. One is antidepressants, and antidepressants are things like alcohol, tranquilizers, heroin, methadone, solvents. And what they do is they depress the central nervous system and affect the whole body. Why people like them is that they relieve tension and anxiety, but they can affect coordination, reaction times, and they decrease self-control. So they're the reason why people are raving at parties late at night. Another category of drugs are stimulants, and these are things like amphetamines, speed, ecstasy, cocaine, legal highs, and they make people feel alert and energized, so they're excited, chatty people. And people take them because they give them energy. So it means that they can do things for hours without getting tired. So dance all night, talk, stay out very late when they're quite tired naturally. Now, the third category that I wanted to highlight to you are the hallucinogenics. So they're things like cannabis, LSD, magic mushrooms, and they can affect the five senses. So everything's involved: sight, sound, touch, taste. They can change the way people think and feel and how they interact with their surroundings. While cannabis is the most used illegal drug in the UK, there are some others which operate as both stimulants and hallucinogenics, and they're things like ecstasy, which is MDMA, and ketamine, which can both have the stimulant and hallucinogenic and, in actual fact, depressant effects all in one. So while people take drugs because they enjoy them, sometimes they're environmental factors, so they live in a place where drugs supply and the trade in drugs is an alternative economy. Sometimes they're curious, sometimes for young people they're acting out of rebellion. This can also have a huge effect on their mental health, because what drugs can do is to retard their emotional development. They get into the habit of actually using drugs when they're feeling down. So they're feeling upset about something, so they take something. They use drugs as a way of medicating their emotions away. And what that does is to prevent that person from actually going through the phases of learning how to function within their emotional platform. So sometimes when they come to therapy, they can be quite immature emotionally. So what counselling can do is it can provide a space for someone to explore where they are emotionally, what it is that drug taking and alcohol taking actually does for them. It's a place where the person that they're talking to, the relationship with the therapist, they're going to be understanding of how difficult it is to manage a drug dependency, so they'll understand the cycle of lapse and relapse, and they can explore the reason with the client for drinking or drug taking. So, and what can be worked on is that client's emotional development. So counselling can provide a space for a client to work through and make long-lasting change. If that is something of interest to you, then give me a call. Get in touch with either me on the Counselling Directory platform or any of the other well-trained and well-qualified counselling practitioners. Thanks very much for listening.